Hi, my name is Ushna Cheema, and I'm a third-year pharmacy student at Xavier University.
And my name is Olivia Redmann. I'm a fourth-year student at Xavier University. And today we're going to be talking about the impact of Hurricane Ida on pharmacy operations and vaccinations in Southeastern Louisiana during the COVID-19 pandemic.
So starting with the introduction and background, the increased frequency and intensity of hurricanes in recent years poses an unprecedented threat to the public health of communities living in coastal areas. Hurricanes are shown to cause and exacerbate multiple diseases with both acute and long-term health consequences. So frequent hurricanes disrupt health services and exacerbate underlying disparities in the southern region. Severe storms can have a lasting impact on the healthcare landscape of the affected areas. Now, looking at the chart, you can see Hurricane Ida made landfall on August 29, 2021. It mainly had a huge impact in Port Fourchon, Louisiana. It was a Category 4 hurricane with 130 miles per hour sustained winds and 160 miles per hour wind gusts. Our research also has a focus on the COVID-19 pandemic, especially on its impact during Hurricane Ida. Through all of this, pharmacists have remained one of the most accessible healthcare providers, particularly in the state of Louisiana, which was greatly impacted by the COVID-19 pandemic, and still has one of the lowest vaccination rates in the country. In the face of natural disasters and healthcare crises like the COVID-19 pandemic, pharmacists have demonstrated resourceful flexibility to meet the needs of patients. Now, moving on to the objective and methods. The purpose of this study was to examine the impact of 2021's Hurricane Ida on pharmacy operations and vaccinations in Southeastern Louisiana during the COVID-19 pandemic. Researchers enrolled and surveyed the pharmacists as part of a vaccine education and surveillance program. Pharmacists from more than 25 Louisiana parishes participated in this study. Surveys were conducted from August to October of 2021. Domains assessed were primary practice setting, prescription fill data, vaccination administration data, and impacts of Hurricane Ida on pharmacy operations and patient care. The data analysis is ongoing, and the study was IRB approved. Now, looking at the demographics, on average, majority of the respondents were females, and the most prevalent racial group was Caucasians. Majority of the respondents also had a doctor of pharmacy degree. Now, looking at the pie chart, for the primary practice setting, the majority of respondents practice in the community pharmacy, with 40% practicing in chain pharmacies and 41% practicing in independent pharmacies.
Now going into the results, so the majority of respondents, which was around 58%, reported that their pharmacies were forced to close due to impacts from the storm, with 39% closing for less than a week, 6% closing for a full week, 8% closing for greater than 1 week, and 4% closing for greater than 2 weeks. The remaining respondents, which was about 42%, reported that their pharmacies did not close at all during the disaster. And during the extended loss of power, 32% of respondents were able to preserve their vaccine stock by utilizing a backup generator, and 15% preserved their vaccine stock by storing them in an alternate location. However, due to their loss of power and refrigeration capabilities, about 19% of respondents completely lost their vaccine stock. And then of those respondents with damaged vaccines, the great majority, which was about 80%, had to wait more than 1 week to receive a new vaccine shipment. And then average daily prescription fills and vaccinations decreased by 15% and 31% respectively during the immediate post-storm period. Now, if you take a look at the graph, on average, the amount of COVID-19 vaccines given prior to Hurricane Ida, which is indicated by these blue bars, were much higher than the number of COVID-19 vaccines given after Hurricane Ida, which were in the medium, low, and very low categories, as you can see by these green bars right here. Now, lastly, for our discussion and conclusion, the majority of respondents surveyed reported that their pharmacies were impacted by the storm and were forced to close, but reopened shortly after Hurricane Ida. Due to the impacts of the storm, many pharmacies had the option to protect their vaccine stock by having access to different resources, but others completely lost their supply. And there was a decrease in the average number of prescriptions filled and vaccines given during the immediate post-storm period. And that concludes our presentation.